in years past to the State Bar of Michigan, where I've spoken in front of conference of elder law and disability attorneys. Anyway, so today the real challenge for persons on disability as you become eligible for Medicare is that it's pretty complicated. The rules of when you actually are entitled to Medicare are complicated. In addition to that, the government isn't really sending out advertisements, or they're not sending out notices to you on a frequent basis. So some persons have had individual health insurance along with SSDI. We'll get into that later in this video. But they don't get told, okay, you're coming up towards your Medicare eligibility date, therefore you can transition to Medicare, that kind of thing. In addition to that, if you mishandle it, the problem is that there are penalties. Medicare has late enrollment penalties for Part B and Part D. We'll get into that and why people encounter the problem and how to try to avoid the problems in the future. Okay. Disability is just one of a number of different topics. Like I said, I've made these types of comments in public. I've made my quotes on this particular topic sitting in Retirement Daily on thestreet.com. You can find other quotes on other topics related to Medicare or financial planning pretty much everywhere that you go. You've also heard my quotes, for example, on radio talk shows. Anyway, here on the internet, you can see me obviously here on this YouTube channel, and there's more sources as well. What you can do is you can go to the website, www.maximizeyourmedicare.com, and you'll find all sorts of links. You'll have links not only to these videos, but to podcasts, over 100 episodes, as well as a newsletter. And if you have your personal private question, you can click the Ask Jay button on that website. You could also leave your comments here below the video. So let's get on to Social Security disability itself. And like I said at the beginning, pretty complicated stuff. There's a reason that there's such a thing as Social Security disability attorneys, right? Applying for those Social Security disabilities is complicated, oftentimes requiring a court hearing. There are Social Security disability judges as well who specialize in these types of applications. And one thing to note here, and is good for the rest of this video, is that Social Security disability is not the same as VA disability. For example, there's no such thing as partial Social Security disability as there is under the VA. The basics are pretty easy to understand, meaning that you're entitled to Medicare after you have received 24 months worth of Social Security disability insurance benefits. 24 monthly payments. Okay, so that also means that, for example, if you went to court and you got approved, it is possible that the judge sets a date from the past, and that, let's just call it some number of months of worth of payments. Those number of months are included, right? Because those were really catch up for when you should have been receiving payments but have not. So once you receive 24, after that period has expired, then on the first day of the 25th month, you're entitled to Medicare. And you can understand why it can be so controversial, right? Because it's not only the Social Security disability insurance benefit that you get, but it also gets you access to Medicare. Very, very important. So like I said, there's the quick example there on your left hand after the 24 months Medicare. And let's just go through a quick example. Let's just presume that your disability period actually was March 2017, right? And that but you did not receive money until August of 2018 due to the judicial process, delays, appeals, et cetera, et cetera. Nevertheless, you go back to March of 2017, right? So from that day, you're going to get 24 months worth of Social Security disability insurance benefits, And I know I've taken a shortcut about the 6-month waiting period, but the real key is, when does the cash flow? Okay, 24 payments worth. So from that would have brought you to April 2019, not September 2020. Okay, so it starts from the March 2017 on this example in this slide. The key point for you to take away, is the fact that when that day arrives, which is April 1st of 2019, it's no joke. You are starting the ticker, the time clock, the shot clock, if you will, for something called late enrollment penalties under Medicare. Formerly, the jargon is ICEP, which is basically that, your original enrollment into Medicare. Okay. That means that from that date, the CMS, the Centers for Medicare and Medicaid Services, are going to start keeping track. And if you don't have health insurance, if you don't have prescription drug coverage, then you can be penalized, and those penalties are permanent. In other words, you pay them forever. Okay? And this is difficult, obviously. Let's take a look at an easy example. An easy example here is back to this March 2017. Your Medicare Part A and Part B effective dates, your coverage dates are April 2019. And your ICEP ends on July 31st of 2019. Now, the issue is that you can only have a lapse of health insurance for 8 months. 8. Okay? If you have a lapse of health insurance for 8 months, from that point, the government starts counting. And for every 12 months from that point, if you do not have health insurance, then you can be charged 10% of the Part B premium for every year, every 12-month period. So in other words, if you go 3 years without, you'll be charged 30% on top of what the standard Part B premium is, and that penalty lasts forever. It is not a one-time penalty. The same thing can be said about Part D, which is the prescription drug benefits. Here, slightly different penalty calculation, which is, it is 1% per month that you did not have something called creditable coverage. And creditable coverage is a form, it's jargon, it's Medicare jargon, right? And it's a term that says that your prescription drug plan isn't as good as the standard Medicare model. So what happens in the background, Medicare says, okay, drug plans have to cover X. And if you have a drug plan that's inferior, it can be called not credible. For most persons under large drug plans from, for example, under health insurance from large employers, and certainly ACA compliant plans, those are going to be credible coverage. Okay, so that's not the worry. It's if there are certain minority of prescription drug benefit plans that do not count as credible coverage. If you don't have credible coverage, after this 3-month period ends, then you get charged 1% per month forever that you did not have. So let's say, again, back to the 3 years, that means 36 months, meaning you get 36 months of the then national average. Okay? And next year, when the national average changes, you're going to recalculate the 36 months for that times 1%, so 36% times the new national average. Okay, to give you an idea without getting into too many details, you're talking about the low 30s as the national average. The reason I'm spending so much time about the penalties is because getting out of the penalties is no small feat. It is very difficult. It's very cumbersome. So let's just take our example, okay? And now, for example, let's say you've waited until February of 2020. February of 2020. Okay. The Part D problem can exist. Why? Because in February, you cannot just pick up the phone and say, Jay, can you sign me up for a prescription drug plan? I just was prescribed a new drug and it's expensive. Can't do it. I'm going to say, Mr. X, we've got to wait all the way until October 15th. And then your coverage doesn't start until the January 1st. Okay. So what looked like you were waiting until February, no, you're waiting an additional 10 months. And during that period, this 1% a month is another percent and another percent and another percent all throughout the time. For Part B, slightly different, but still a problem, right? This person lucked out by calling me in February, right? Mr. X calls me in February. Jay, I want to be enrolled in Part B, actually. I realize I need to have Part B. I'm going to tell him, okay, you're in luck because we're in the first quarter of the year. And during the first quarter of the year, if there's been any mishap, some reason you have not enrolled in Part A or Part B correctly, the first quarter of every year, you can do so. Now, the hook is you've got to wait until July 1st. So in February, it's not as bad as waiting until January, but you still have to wait until July. So this is, these are the kind of things that people don't understand when you're on SSDI and then you transfer over to Medicare and then you think you don't really deal with bills necessarily, and we'll get into those situations on when you don't. So you're not recognizing that these penalties can occur. And that's just the first set of issues, okay? The second set of issues over here is really on the next part of today's video, which is, unfortunately, I meet lots of persons when they turn 65. They call me up and they say, Jay, I read your book. Can you help me out? The answer is yes. I speak with the person, I get some extra facts, and it turns out that they were on Social Security disability since the age of 59. And my question then becomes, okay, what did you do from the age of 59 until now? And they said, well, I was covered by my spouse's employer. I bought an individual health plan for myself. Okay. Yeah. And now, unfortunately, I don't get to put us back into the time capsule, because if I had and then teleported us back to today, they'd have thousands of dollars extra. In other words, yes, they've used thousands of dollars that would have otherwise been theirs. And I'm not exaggerating by thousands, not at all. So let's just take a look at this left column. Very common problems. People don't enroll in both parts of Medicare. So what happens? You get your card that says Part A, Part B. You say, okay, I already have all the insurance. I don't want to pay for Part A. You cancel Part B. That happens. But the problem here, and we're going to get into some hardcore examples, some true examples, is that the sticker price of Medicare plus Medicare Advantage, which is frequently zero in most parts of the country. There's a plan that costs zero that will fit many people's needs, right? So $144.60 is the premium for Part B. The issue is the fact that they could have paid that and also had extra coverage at zero instead of paying for their small group employer plan from their spouse, COBRA. You could be a spouse of an employer of a large employer. And then, like I said, again, the number is in the thousands of dollars. And let's just take a quick example. And here it is right here. Right. So now you're married and you're the disabled spouse of an employee. And that the employer charges your spouse $300 a month for you. So in addition to overpaying $300 versus $144, It's not only that, because that's not even where the problems begin. That's just the beginning. Because the fact of the matter is that whether you're in the individual health plan, whether you're an employer plan, after looking at scores and scores of comparing, the conclusion is that Medicare, even Medicare Advantage, that can cost zero, will have lower copay, lower deductible, can be lower out of pocket maximum, and much lower premium, all of them. So basically the bottom line is that when people are in SSDI and they keep some other type of health insurance, which is not a Medicare plan, okay, which is not a Medicare plan, they end up paying more for less, much more, for much less. And there's, the punchline today's video, there is, here's what you can do, and here's how to get onto Medicare, but that's only the first step. This second step here is vital and very costly, or to other persons, very profitable, right? Because they do get to turn on their Medicare Advantage plan, for example. We'll get to Medigap later. To Medigap, to Medicare Advantage at $0, their cost of health insurance for themselves is declined the moment they become Medicare eligible. Certainly there are nuances, don't get me wrong, right? I mean, meaning that there's things like IRMA, for example, your spouse is a high wage earner, okay? Can there be nuances from this standard set? Yes, there are. Do you need expert help in navigating? Candidly, you do, okay? It's difficult stuff if you're not on this main track, if you will. So the next one is more mistakes, and mistakes are easy to make because, hey, check it out, I just repeated, easy example 1 right here on more mistakes. So we'll just skip to example 2, shall we? And just forget that I made this error. The example number 2 is people keep their ACA compliant plan, which means they signed up on the healthcare.gov. They went to their state exchange and they got something called APTC, right, which is the Affordable Healthcare Plan. And maybe they did get the lower premium, maybe they didn't. And it doesn't even matter, to be candid with you, because like I said, the premium could be close to, it can be lower. It's not likely to be lower than $144. The coverage is still going to be much weaker, right? In other words, a silver plan, a gold plan on the exchange, you're talking about $2,500 individual deductible. Medicare Advantage, $200 at worst. There are many plans in the country with $0 health deductible that are Medicare Advantage. So what ends up happening is people don't understand what numbers, what figures actually exist. So you just think to yourself, okay, well, I'm on SSDI, get my Medicare, Part A is free, Part B, fine, I pay $144, and then I'm going to find some other secondary. But the reality is the secondaries that exist in the Medicare world are much cheaper and the coverage is far superior. So people, that literally is setting money on fire, literally. The bottom lines here are starting up on the next slide here. And you can hear it. I've already kind of, I've given you the sneak peek, haven't I? Don't miss your shot at Medicare Advantage. At least consider it, right? My job as certified financial planner is not necessarily to dictate to my clients, look, you have to this, you have to that, you must this, you must that, slam dunk layup. That's too extreme. That's too extreme. However, given what I've said here in today's video, it's at least worth a very, very careful look. And it's been my experience, real life experience, that those are the comparative numbers. And like I said, I feel bad in those cases, right? Because on a personal level, I feel bad. The person, I didn't know that person when they were 59. They called me at 64 and a half. I couldn't take us back into time capsule, like I said, 5.5 years ago and say, hey, get off your spouse's plan where they were charging you $600 a month, go to Medicare Advantage at $0 a month for far superior coverage because your out-of-pocket maximum is $4,000. So even in the worst case scenario, you're better off by $2,400. Do you see what I'm saying? This kind of thing happens. So at least consider Medicare Advantage. That's an absolute. The one thing I do need to talk about is Part D here. And, let's just say, for example, you have health insurance from some other place, or, for example, you've got some situation where auto insurance company pays for all your medical expenses due to an auto-related injury. This happens, right? I've met persons like this. And they say, okay, well, since the auto insurance company is paying for my, pain management, very, very common. That doesn't exempt you from the Part D time ticker. Okay, it doesn't. So in addition to the Part B, there's also the Part D. And let's just say you thought you were in perfect health, so you bought it. So, you thought, well, the medications for pain management were being paid for by auto insurance company. The issue is somewhere in between. If you required, let's just say, hypertension medication, even if inexpensive. Let's say you were diabetic, you required insulin, and you wanted to get insurance. The auto insurance company is paying for the medication directly related to the auto accident, not to another medical situation. Not for the other medical situation. So then you call me and say, Jay, can you help me with Part D? I say, yes. Do you realize, since you've had no credible drug coverage, the late enrollment penalties for Part D do apply to you? So again, remember, 2 late enrollment penalties. You need to do your best to try to avoid them both. So you can imagine in my everyday walk of life, when I'm talking to clients from different backgrounds, I get lots of questions whether I'm making presentations in public, for example. And here are a couple of very frequently asked questions. First of all, can I get Medigap? The answer is maybe. And the reason it's only maybe is because the state that you live in may or may not require carriers to offer Medigap to you prior to 65. Okay, that is not necessarily a requirement. In addition to that, even if they did offer it to you, there's nothing to say that they can't charge a much higher premium. And by much higher, what I mean is more than $200 a month than if you were first turning 65. That is very easily found. Okay, so fine. We're back to the 59-year-old. Says, Jay, I want to have the Rolls Royce. I want to have Medigap now. I have to check on where they live. And then if that's a state where they do allow it to be sold to pre-65 people, then I've got to check the rate. And the practical reality is that the rate is so high that we can find alternative under Medicare Advantage where literally, just like the $600 a month example, the premium that you for sure have to pay can be higher than the out-of-pocket maximum under Medicare Advantage. So why would I pay for this? Right? Because I have to pay for this with certainty. Over here, this is the maximum financial limitation. That can happen. That can absolutely happen. So now we're to go back to the 59-year-old. The 59-year-old is now 65, 64 and a half, has now called me and says, okay, Jay, I've been on SSDI. What happens when I turn 65? Well, you're a brand new baby. You've never had a medical history. Medicare knows you as having perfect health. You get a second bite of the apple, just like your twin or cloned brother or sister who was born on the same moment with no disability. You're the same in Medicare's eyes. You get your access to the unlimited, unrestricted best plans at the best price available in the market, period. Period. So the reason I bring this point up here under frequently asked questions is that people don't realize this. And then they let the time pass, and then they call me not at 65, but they call me at 66. And they say, I just heard this, that I could have gotten Medigap. Can I get it? And I say to them, yeah, you can get it, but the questioner, the issuer, the insurance company is going to be allowed to ask you medical questions at that point. So for those of you who have received SSDI benefits, just connect the dots here, right? You're on Medicare as a result of medical situation which has prevented you from work in your past. And now the insurance company gets to ask you medical questions about your history. Your likelihood of being accepted isn't great, and that's being kind. That's just your practical reality, right? I mean, and in fact, most Medigap carriers, if not all, I can't think of who doesn't ask this question, is that are you enrolled in Medicare because of Social Security disability? That is a question on applications. So you can connect the dots. They're not that far away. Other questions I get asked are about things like Medicaid, for example, which is, okay, Jay, I'm 59 years old and I get SSDI. Can I get Medicaid? And so I don't have to deal with either the 144 and just have the state be the provider of my health insurance. The answer is not really. For the vast majority of you, the answer is going to be no. And the reason is not because just as a rule, but because the payment level, the amount you get as a Social Security disability insurance payment and SSDI payment is too high for the income requirement for Medicaid eligibility. Okay, so it's usually the case that someone on SSDI doesn't also get Medicaid. That said, there's a very important second point. You can see it there, the one that says, however. You can always, you'll be able to get that from me. When I put something in all caps, the however, something that says, however, you should pay attention here. Because what people think is that Medicaid is the same as extra help. They are not the same. Medicaid, over here, was it over here? Medicaid is insurance for health insurance, which includes extra help inside. Includes it. Extra help is only for prescription drug plan help, financial assistance. Your premium for your Part D can be zero. Your copays for prescriptions can be much lower than copays under a Medicare Advantage plan or a Part D plan. Okay? There is an income level in between here where you may not qualify for Medicaid, but you do qualify for extra help. And many people overlook this. I mean, many people in the general population, so you can especially tell in SSDI, right? They think to themselves, okay, I'm going to try for Medicaid. They've been told no. They mistakenly think that extra help is the same thing. It isn't. Not precisely. Not precisely. On MaximizeYourMedicare.com, there's a link there, how to apply for extra help. I think I've covered the last frequently asked question, haven't I? Yeah. So the penalty, remember this, and I bring it up a second time because, I've seen tragedies. I've seen tragedies where something wrong happened, unfortunately. Policemen who are disabled as a result of, in-duty work, right? And outside of the headlines, this happens. We know it does. And what ends up happening is young persons, much younger than 59, get access to Medicare. They get their pain medications from civil lawsuit, some other workers' compensation program, right? And they're perfectly fine in other aspects of their life. So they don't really have a medical issue for high blood pressure, the common ones that many people have. So they don't go to the doctor. But again, it's easy to overlook this, that the payments from the workers' comp, the payments from auto insurance, that's fine. That's made you cash neutral because you didn't have to pay. That didn't turn off the late enrollment tickers. So that's it for today. Be sure to subscribe to the YouTube channel. Disability, Medicare, it's just a simple example, a little bit more complicated one, but that's the world we live in now. We're not going to be able to live in a place where we're just going to be able to detach one topic from another without some kind of overlap. It's for that reason that I deploy as much knowledge about different topics all together at the same time. That's the point of the channel. Yes, am I going to provide the basic building blocks to Medicare or life insurance or Social Security? Yeah, that is because I have to. But the reality is, the real value that I add to my clients, hopefully that's what they're telling you, is the combinations thought through together. I'm Jay. Thanks for watching today. This is the Maximize Your Medicare YouTube channel. Please share it with your friends. Leave your comments below. Thanks.